Senator from Maryland.
We're at a critical point in our battle against COVID-19. While we're still losing Americans to the virus, we have reached a stage where most of us are able to resume many of the daily activities we used to regard as normal. But our sustained effort to improve health outcomes and keep our economy on track is running out of funding. Now is the time to act. Over the last 2 years, our communities have taken necessary mitigation measures. Healthcare and frontline workers have given everything they have to cure for our loved ones. And the Biden administration, with funding provided through the American Rescue Plan, has worked hard to ensure we have the resources necessary to continue to adapt our response to COVID-19. After the peak of the Omicron variant, the reduced COVID-19 transmissions has made it safer to reconnect with friends and family and resume some of the activities we've all missed during the past 2 years. Due to the tireless work of the Biden administration, testing capacity and therapeutics are more available than they have been at any time during the pandemic. Over 81% of Americans who are 5 years or older have had at least one COVID-19 vaccination, and nearly 50% of Americans who are eligible are fully vaccinated and have had a booster. In Maryland, 91% of Marylanders 5 and older have at least one COVID-19 vaccination shot. Overall, we have made significant strides in fighting the COVID-19 pandemic, but the threat is not over. Many Americans have children who are too young to be vaccinated and are immune compromised or otherwise at high risk, so they may not be able to resume normal activities. While positivity rates and hospitalizations are decreasing, almost 700 Americans still are dying on an average each day. Additionally, new variants continue to emerge. Countries across Europe and Asia have seen new spikes in cases due to a more contagious version of Omicron known as BA.2. We could soon see a renewed surge, as we have oftentimes only weeks behind rising cases in Europe. And this latest subvariant already makes up 35% of the cases here in the United States. Fortunately, at this stage, BA.2 appears no more severe than the original Omicron variant. In the United Kingdom, however, as BA.2's increased, children 2 to 11 years old had the highest rate of infections of any group in the country, the younger children. To respond rapidly to emerging variants, we must keep financing pandemic prevention and response needs. The White House and the Department of Health and Human Services have made it clear that at least $22.5 billion of additional funding is necessary to replenish pandemic prevention programs that are nearing depletion or have already been depleted. Without these funds, we will have to cut back on critical aspects of the pandemic response. Here are some examples. Our national testing capacity will decline, leaving us vulnerable and less able to detect emerging variants. It will become harder to diagnose infections early enough to take effective treatments. Also, uninsured individuals may no longer be able to access vaccine tests and treatments for free. This will cut off a critical support for uninsured individuals and health providers who care for them if they could become ill with COVID-19. In addition to testing and acute care, vital COVID-19 research will suffer if we do not provide sufficient funding. Continued development of new medications and vaccines is critical, but without additional funding, research will stop, leaving us potentially vulnerable to a variant resistant to our current arsenal. Specifically, the National Institutes of Health may shut down some of its COVID-19 research. Further, the Food and Drug Administration recently granted an emergency use authorization for a new monoclonal antibody treatment that is effective against Omicron variant. Without additional funding, however, the federal government won't be able to continue ordering the monoclonal antibody treatments, vital therapies for immunocompromised patients, and antiviral pills, all of which are already in short supply. Additional funding is critically important if we want to see the United States continue its leadership role in distributing vaccinations across the world to prevent more and worse variants from taking off and arriving on our shores. I will continue to fight to ensure that we get additional COVID-19 funding. The American Rescue Plan Act demonstrated our ability to pass legislation that quickly ramped up pandemic response efforts and effectively mitigated the negative economic impact of the pandemic. This legislation has been critical in helping individuals and communities respond to the challenges brought on by the pandemic. Local governments have had to provide essential services at unprecedented level, and they have risen to the occasion without falling into financial ruin. Now is not the time to take the foot off the gas. Restaurants, for example, still need help. The American Rescue Plan created the Restaurant Revitalization Fund, but the $28.6 billion provided to the program was not enough to meet demand. I remain gravely disappointed that the fiscal year 22 omnibus spending package Congress passed earlier this month did not include additional assistance for restaurants and other hard-hit small businesses. For the last 2 years of the pandemic, nearly all restaurants have been under great strain as they've struggled to keep staff and adapt to the new variants while facing increased pricing due to supply chain disruptions and inflation. And those have been the restaurants fortunate enough to survive the pandemic. Thousands have closed their doors for good. More than 100,000 restaurants received grants from the Restaurant Revitalization Fund that have helped them keep their doors open. But more than 180,000 restaurants that submitted their applications on time to receive funds, their applications were there, have received no funds at all. That's not fair, and they desperately need our help. If Congress had not acted quickly to replenish the Paycheck Protection Program when it ran out of money weeks after it opened in April 2020, and we did that, by the way, by strong, almost unanimous support, and it was hundreds of billions of dollars that we were short, the program would have been half measure necessary to be sufficient. Instead, we extended the emergency aid needed to meet the crisis we face, and that's exactly what we need to do again with the Restaurant Revitalization Fund. For the past 2 years plus, I've worked hard to secure vital resources to fight the COVID-19 pandemic and ensure that those who are struggling from the economic effects or emotional toll have the necessary support going forward. I will continue that fight. The novel virus continues to challenge our nation and the world, so we must be prepared. I urge the Senate to pass necessary additional funding for COVID-19 relief so Americans can continue to face this challenge head-on and prevail. Mr. President, I would suggest the absence of a quorum.
The clerk will call the roll.
Ms. Baldwin.